Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. Today I'd like to talk about the audit focus on medical necessity. One of the major areas reviewed during an audit of a laboratory performing urine drug screening is documentation of medical necessity of the testing. Criteria to establish medical necessity for the drug testing must be based on patient-specific elements identified during clinical assessment of the individual patient, and all must be documented by the physician in the medical record. The medical record should contain evidence of patient history, including prior laboratory findings, physical examination, treatment plan for the patient, and overall provide evidence of the reason for the laboratory testing and the analytes being tested. Neither the AACC Academy nor pain management organizations provide hard and fast rules for the frequency of testing. Most guidelines or consensus statements recommend testing prior to beginning acute or chronic controlled substance therapy. For low-risk patients, the AACC documents speak to testing at least twice a year for low-risk patients and more frequently for those at higher risk. Higher risk patients include those with a personal or family history of substance abuse, mental illness, evidence of aberrant behavior, or other high-risk characteristics. The CDC recommends that patients prescribed opioids be tested to identify prescribed substances and detect use of unprescribed and illicit substances at least annually. If testing is being performed at frequent intervals, evidence of medical necessity in the medical record must clearly be documented. It is necessary that the physician who actually is treating the patient order all the laboratory tests, and that the medical record indicate the ordering of the laboratory studies. It is not necessary that all requisitions coming into the laboratory be signed by the ordering physician, but the laboratory must ensure that the physician has signed documentation of the ordering and necessity of the test. It is in the interest of the laboratory that there be a signed agreement with all providers using the laboratory that in the event of a laboratory audit, the physician will provide documentation that they ordered the study and evidence of the medical necessity for the study. It is helpful to also have